Today we're talking with Dr. Allan Sosin. He's the founder and medical director of the Institute for Progressive Medicine. Dr. Sosin, what is your usual protocol in dealing with your patients who come to you?
Well, first thing is we spend time with them. We want to find out about the patient. So it's not one of these things where you come in and you have 12 or 15 minutes to deal with the whole thing. We spend an hour with new patients and a half an hour with revisits. So we have a chance to learn quite a bit about who we're seeing. And, you get into the whole history. What's the current problem? What are the past problems? What are your problems in life? What are the stress factors? What do you eat? All of these things need to be brought up because, you're dealing with the whole person. You're not really dealing just with a painful ear, or a case of gout. You need to know what's going on with the person. So we need time, and we use time for that.
Good. How did you end up where you are now? Give me just a little background of where you came from.
Well, I'm traditionally trained. I went to Northwestern University Med School in Chicago. I did a residency in internal medicine. I did a fellowship in nephrology, which is the study of kidney disease. I worked in nephrology for 5 years, then decided it was a little too narrow for me and I wanted to be more into all of medicine. And we moved from New York to Philadelphia, at which time I got involved with a number of different things, including the Institutes for the Achievement of Human Potential, which is a place that treats brain-injured kids, and it's holistic. So that was my first exposure. They work with kids with cerebral palsy and different kinds of brain injury, Down syndrome, autism, and they don't use drugs. They take kids off of drugs, and they give them good diets, and they give them nutritional supplements, and they give them very powerful, stimulating treatments, intellectually and physical, to raise their level of function. And I saw some really dramatic effects, and also the numerous failures that occurred with conventional medicine using drugs. Because if you give a drug to a brain-injured kid, you're going to put him into something approaching coma or some sort of suppression of brain function, and that's not what you want. So in seeing that and learning those techniques, it just carries over into what goes on with adults. And what we have in our society these days is adults getting suppressed in a way with the same kinds of medications. You have this physical problem, and here's your drug, take this. Or this mental problem, here's your drug, take this. Or this drug problem, here's a different drug, take this. And we replace the illegal drug with the legal drug, and we think that's okay, and it isn't. It just doesn't work.
Dr. Sosin, give me an example of what would be a successful addiction treatment program.
A successful program would be one that first gets the person off of whatever drug or alcohol they're using, and two, gets rid of toxic things in their system, like we've been talking about today, changing the diet around so they don't have more poisons going in just from the foods that they eat. Getting them on a multivitamin and mineral program so they're not nutritionally deprived, because it's been well established that people who are fed well and who are not nutritionally deprived will do better and be able to get rid of their addictions better. And after that, you want to set them on the right road as far as how they live the rest of their lives, which to me is the most important and maybe the most complicated part of dealing with addiction. I mean, you've cleaned the person up or helped them clean up. Now what do? Do they just go back to the same life? Do they act in the same way? Do they go with the same people? Do they do the same job? Do they commit the same crimes? Because if they go back to the life they left, they're not going to be successful. Addiction is a manifold type of a problem, and it always is connected with things going on in that person's lives which are not ideal. They need to change, and the person needs to be taught, instructed, educated on how to live a life that is drug-free and also productive, doesn't require drugs, and actually does better without drugs. Because what goes on with all addicts, basically, is they think they're doing better with what they're taking, and they're not.
Give me a good example of a patient that you took who was really in bad shape and you healed them.
We had a good recent example. This is a 23-year-old fellow who was using street drugs, methamphetamines, and got into trouble with the police. He got picked up for possession and being under the influence, and was deposited in a psychiatric hospital. And his mother agreed with this because she had seen the problems he was having with the drugs, and she wanted him in a hospital. So he goes into the hospital, which does standard things, and the amphetamines are gone, but now he's on 2 psych drugs, and then 3 psych drugs, and then they switched the drugs, so he's on 2 other psychiatric drugs. And there he is, and the mother thought that it was fine for him to be on these drugs, be in the hospital, and stay on them. She even wanted him to go on disability as a disabled person who's a drug addict requiring drugs. And some other family members didn't agree with that course of action. He wasn't too happy about it. So they got into the affair and arranged for me to work with him and for him to go into a drug-free type of facility. So he came to my office, met with me. He was kind of out of it. I think mainly because of the drugs he was on that he was being given in the hospital. So he was kind of confused and slow, and it didn't look quite right. And I was kind of worried about him emotionally. I said, "What am I dealing with here? Is this a person who's mentally ill, or what's going on with him?" But we went on, and actually to get him out of the hospital, I had to sign a form that I would be legally responsible for his medical care, because the doctors wouldn't let him out of the hospital without someone, saying they would be responsible. So I signed a form, fine. And he comes, and we take care of him. We get him off the psychiatric drugs, which took about 5-6 days. And then he went into a program that is a favorite of mine, which is the Narconon program, which is a drug-free program. And it's a long-term program in the sense of a number of months required for the education and also for the final detoxification, because it's not enough to just get off the drugs that you're on. You want to get them totally out of your system. So he went through a sauna program, which we had to approve him for, and he was fine with that. That takes about 3-4 weeks. And after that, you go into the educational program, which involves actual study of a number of texts, actually 8 of them, and you learn that material, and it's a hands-on type of learning. So you not only read the book and talk about the book, but you actually use those materials in dealing with other people. And he went through the course, and I went to his graduation about a month ago. And I wanted to go to that graduation. They have this ceremony where the person graduates from the courses and then stands up and talks about how it went and what they're planning to do with things. And he got up, and I was really impressed with what he was like, because he'd become a normal human being. He could look you in the eye, he could laugh, he could smile, he could tell you about himself, and it was like having a normal person to converse with, as opposed to somebody who's either stoned out or drugged out or whatever. And he was fine. And the end of that was that he when he left the program, he didn't go to live with his mother. He went to live with his aunt, who was strongly in favor of his not being on any drugs, not being on disability, and having a life that he could control himself. And he then went out and got a job, and that's what he's doing now. Totally different person.
Wow, it sounds like you really saved his life.
It's remarkable to see the degree of change that can occur in somebody in a relatively short period of time, because addiction is usually not a 1 month or a 3 month or a 6 month thing. It goes on for years, even in a 23-year-old. I don't know when he started, but a lot of these kids have started when they were 11, 12, 13, 14 years old. A lot of them were actually started by their doctors.